How does smell work? The sense of smell is one of the most important senses in the body. This is how the sense of smell works. The smells we are able to detect are actually particles or chemical substances floating in the air. They float through the air and make their way towards our nose through the nostrils, then entering the nasal cavity, getting picked up by one of the 5 different types of olfactory receptors. It depends on the smell or particle to which receptor it goes to. An example is the odorant receptor, which detects that you are smelling, sending that information to the brain, or the olfactory nerve. To prevent harmful bacteria from entering the body, there are small hairs in the mucous membrane, the secretory cells, that clean and filter the air before it travels to the olfactory membrane, where there are cells in charge of collecting the information and sending it to the brain using the olfactory nerve. The brain is in charge of recognizing the chemicals of the smell and reacting appropriately to it. The brain then transmits the signals for reaction to the rest of the body, so it can do what it needs to. For example, if the nose detects a smell of smoke or burning, then the brain will receive the information from the olfactory nerve and associate the smell with fire. Then it sends the signals to the body so it can react and get away from the fire. If we didn't have our sense of smell, we wouldn't be able to taste food, and therefore life would not be as good, and in a severe case, some may lose the drive to live. During COVID-19, the outbreak, there were reports of people losing their sense of taste and smell for a variety of different time periods. Most patients recover their sense of smell within 1 to 2 years later. Some sooner, some later. COVID also has the ability to change your sense of smell completely. Like when you smell something completely different and unrelated to the object that smells. We still have yet to discover the cause of this. However, Peter Brennan, a reader in physiology at the University of Bristol, says that there are 2 possible options for a cause. Say that there is some good food in the area, as you can get near it as the particles waft in your nasal cavity and attach it to the olfactory sensory neuron cells that can detect what we smell and send that information to the brain. COVID could be killing off those sensory neurons, keeping the signal of what you smelled from getting in your brain. Another possibility is that the information, which is part of the body's response to fight off COVID, causes swelling in the nose, which blocks the airflow to prevent odor molecules from getting to the sensory neurons in your nose. But how does this affect taste? Well, it really affects flavor. Taste buds can still tell if something is sweet versus salty. But the way we process the intricate flavors of food is by combining what we smell with what we taste. That is why when the nose is blocked, we can't smell the food. It might taste bland. And that is how smell works.